Hello, everyone. Welcome to Medicamentum Authentica. I'm Dr. Andrew Kaufman, and this is my weekly show. Thank you for joining. I want to introduce a very special guest today. We're going to do things a little bit different, and I have Dr. Dirk Jacobson here, a dentist from Australia with 30 years of experience. And Dirk and I actually have met each other personally, and we connected recently because we found out that we have a lot in common about our opinions about healthcare and medicine. And Dirk does some very interesting things in his practice. And one of the things he specializes in is the safe removal of amalgam fillings. So we're definitely going to talk about that today, as well as some other things. So welcome, Dirk. Great to have you here.
Hi, Andy. Nice to see you.
So, Dirk, do you want to tell us a little bit about your recent dental practice and where you're at in your career and your experience, and let the viewers just learn a little bit about you?
Yeah, okay. So, as you mentioned, I am a dentist here in Hobart, Australia, in Tasmania, and I graduated from the University of Hamburg some 30 years ago. So, I've got 30 years of experience. I moved to Australia in 2001, where I had to resit all my Australian exams to be qualified here. So
That
I've
sounds
worked,
like fun.
yes, it wasn't, but that's a long time ago, and I've been working here in Australia ever since. So that's a bit of my background. And as you mentioned, I am specialized in safe amalgam removal. People from all over Tasmania visit me and my surgery because I'm doing a safe amalgam protocols, which we can go into a little bit more in depth if you want to. And I work closely together with a health practitioner, with natural health medicine practitioners here in Hobart. They send me some patients who they feel need to have their amalgams removed, and that's what I'm doing.
Well, that's
Apart
fantastic.
from
And
general dentistry.
yeah, that's really exciting, and I know that people definitely want to hear more about that. But I thought we might start with just some of the basic issues that we all face in dentistry and taking care of our teeth. You know, like tooth decay, crooked teeth, braces, all that kind of stuff. And you had mentioned someone who is a very important figure in historically related to this issue that you might want to talk about, Weston Price.
Yeah, Weston Price was a dentist in the US, and he lived some 100 years ago, and he did some very important research. So what he did is he went out to different countries, which were, and he visited populations in those countries which somehow were at the cusp of industrialization. So they were changing their diet from their natural diet to the industrialized diet. So he
So we're
visited.
talking about like manufactured food here, like Kellogg's cereal and things like that when that came into existence.
Exactly, and jam and all that sort of stuff that was suddenly introduced into those populations. So, to my knowledge, he visited populations in the remote Alps of Switzerland, I think Eskimos and people in the Amazon and the Australian Aborigines. And so he was comparing. So he had some people in those populations who were introduced to our modern food and some who were still sticking to the old sort of ways and having their natural kind of diets. And what he found is a tremendous difference. So suddenly people got introduced into the modern diet and they developed tooth decay. The teeth were literally rotting away in their mouths. And the
Wow.
jaw.
So Dirk, are you saying that before the Industrial Revolution and our food changed, that there was no tooth decay?
Yes, it seemed that way. That was the outcome of his research. And
Wow.
after introducing all these industrialized foods, they developed all sorts of problems. And that, like tooth decay, and the jaws were not formed properly anymore. They didn't have the strong jaws, and the facial structures were just underdeveloped, just
Wow. So
like in our Western civilization these days is.
Right. So since our jaws and facial structure is underdeveloped, what are the consequences of that?
Well, for example, like the jawbone, the mandible and the maxilla. This is the mandible, the lower jaw, and the maxilla goes up to the eyes somehow. If they are underdeveloped, that has consequences for so teeth crowding. So we do have some 16 teeth in the bottom jaw, including the wisdom teeth. Now, if your jaw is not big enough, there's no space for your wisdom teeth anymore. And that's why we in our civilization have so many problems with wisdom teeth. And they can turn into quite serious problems. And many, many wisdom teeth need to be removed because of that, because there's not enough space anymore. It's a bit like if you have a football stadium and you have to put certain seats into the stadium, but you don't have enough space for them, and then suddenly everything gets crowded. And that's a little bit the principle that happens when there's not enough space for all the teeth to grow into the right position. So you have impacted wisdom teeth, and it's quite a serious problem. And that's the reason why they have to be removed. For the upper
Wow.
jaw, yeah.
Yeah, so Dirk, you're saying that back before we changed how we eat, that somehow the jaw grew bigger and was able to actually fit all of our teeth because, I
Exactly.
think a lot of parents out there will recognize that as their kids get to be around 6, 7, 8, 9, 10, and they go to the dentist, they notice that the teeth are starting to get crooked, right? And they say, well, maybe it's time for the orthodontist. And what do they end up doing? Pulling a bunch of teeth. Right?
Exactly.
It's like so you're saying that we actually weren't born with extra teeth, that
No.
there's a different problem.
The problem is that our jaw bones don't grow properly anymore, and that's related to the diet. But it also has consequences to the upper jaw because the upper jaw somehow it's the if our upper jaw, the maxilla bone, grows properly, then we have all the other structures like the sinuses being developed properly, and the whole breathing is the breathing process is with diminished size of the maxilla somehow uh, hindered, and it starts to so we have the whole breathing issue. People start mouth breathing, which has completely different consequences to it, mouth breathing. And so there are lots of consequences. You mentioned modern orthodontics. Thankfully it changes a little bit, but see, the patients that I see in the 20s, 30s, and even 40s that have received orthodontic treatments, they were often treated like the jaw is too small. We just take out a couple of teeth from the top and the bottom so that we gain space by removing teeth and therefore can align those teeth properly. But
Right.
that has consequences because if you do it in that method, then you don't support somehow the growth of the jaw anymore, and you actually narrow the space for the tongue, and again that has consequences with
Right.
breathing. Somehow you block off the airways by doing that, and this has tremendous uh, disadvantages in the long run if you somehow manipulate the breathing process, which is a completely different issue. But
Right.
this is
So let me, if I may interrupt you, Dirk. So what you were saying a minute ago, and I want to get back to the breathing, and I have some things to say about that. But you were saying that like when I was a kid, they actually pulled teeth out of my mouth and put braces on, right? So
yes.
I'm very familiar with this. But so you're saying if they do that instead of leaving the teeth in there, that it actually affects further growth of the facial bones?
Well, the growth is obviously stops at a certain time. Yeah, so mostly those teeth are pulled in teenage years when growth is almost completed. But these days, you can actually support with some more functional devices. You can actually, at an earlier stage, support the growth of the jaws, so that these problems that you gain space by proper jaw growth actually, and with the right nutrition. And orthodontics are going that way these days. But see, I see more the consequences of what happened in the past.
Right.
Yeah.
So so is it known what these dietary factors are that are, is it something missing, or is it something that like toxic that's causing the problem with the growth?
Well, I do believe, coming back to Weston Price, that it's related to missing stuff in our diet, and he laid it out. So it's probably mostly the fat soluble vitamins that are missing. And he found that in the diets of those older cultures that were still relating and eating the good old natural stuff. So he found that there was also something which he called the activator X, I do believe, which he did
Hmm.
not quite know what that was, but he related that to, uh, for example, when cows were eating the fresh growing grass, uh, those people, and he found similar things in different cultures, and that was supporting good growth. So later they found out, or actually only fairly recently, that this activator X is the vitamin K. So that, and he put it on, and now we can put it all together. So we can establish some sort of diet, and you're probably the expert on that. That
Well,
is,
this vitamin K, this is not the same vitamin K that they want to give an injection to newborn babies, right? Is a slightly different version of vitamin K, isn't it?
yes, I do believe so. So I'm not familiar which vitamin K they want to give at birth, but that's more your field of expertise, Andy. So,
Sure. Well, let me just speak to that for a moment because when I went through my medical training and residency, they spent very little time talking about vitamins and nutrition, but I certainly remember vitamin K. And what they told us about it is that it's important for blood clotting.
yes.
But this is vitamin K1. And they never said that there was such a thing as a vitamin K2, but I too learned about this from Weston Price's research. And so vitamin K2 is quite interesting because, like you said, one of the main sources is that when some of the ruminant animals we eat are allowed to eat their natural diet, which is grass, then they actually convert the K1 in the grass to vitamin K2. Humans, I understand, are not able to synthesize K2 from K1, so we need it in our diet. So one way we might get it would be from eating grass-fed animals, which is how it would have been before factory farming came into existence. And the other way that you can get vitamin K2 in your diet is from fermented foods. And once again, we have really gotten away from growing our own vegetables, which would require us to preserve them during the winter months. And fermentation was a very common way to do that. So we got away from eating grass-fed meats, and then we also got away from fermentation. So do you think those factors contributed to this deficiency?
Yeah, absolutely. Because we don't have that in our industrial diet, and that's the problem. If we could introduce that, which is probably not that easy, but it probably many people have to change their whole way of living to introduce all these things again, because they are not that readily available if you go to the supermarket. So there's a problem with our whole civilization that is built that way.
Right. And
So
more and more, I'm encouraging people to try to get their food from local growers, and especially the meats, because I mean, in my community and many others from other people that I've met, there are local ranchers who do pasture raise their animals, and even if you can't find anyone local, a lot of these operations are actually selling their products online, and I think it's definitely worth it to look into that for this reason.
yeah, if you have availability for that, see, Lauren, we sourced our milk from a farmer here who didn't pasteurize or homogenize, but he was shut down because this sort of stuff is illegal in Australia, so you can't get it anymore.
Right.
There was a loophole if you somehow pretended you have milk baths, then you could buy it, but it's getting to a very ridiculous point. So you cannot buy it because some kids got some infection somewhere, and then they shut it, the whole operation they had to shut down.
Right. Well, I
Just
can't tell you how many people that I've worked with that actually have disease from pasteurized dairy products.
Yeah.
There's a lot of problems with that, and I should maybe talk about that on a show unto itself. But I will also want to add about the nutrition issue because, most people think, teeth are made of calcium, right, like bones, and they worry about, about calcium deficiency. But actually, I think calcium is pretty readily available in our diets, and it's really these fat-soluble vitamins that you mentioned. They're the vitamins that help provide regulation for bone growth and development, right? Because our bodies are constantly changing and remodeling our bones. They're making them stronger or they're dissolving them and using the minerals for other purposes, right? So if we can support that regulatory process in our own bodies with the proper nutrition and the fat soluble vitamins, I'll just review again, are D, A, K, and E. And I think in the dental issue, the most important ones are A, D, and K, and specifically K2 that we mentioned.
Yes.
So would you agree with that?
Yeah, definitely. K and D, they build strong bones and teeth. And if you can find supplements that contain especially D, then it's a good start because the vitamin D somehow you need it to absorb the calcium in the gut. Because everybody's always going on about you need calcium supplements, but without
Right.
the vitamin D, it's not absorbed properly. And the vitamin K somehow distributes it nicely somehow where it needs to go into the bones and into the teeth. So that's why they are
Excellent.
so important. Yeah. And
Well,
yes, as you mentioned, and those vitamins they can be found in green leaf vegetables, I do believe, fermented raw cheese and kefir, and yeah, other nutritions that
right.
supplementing is probably the way to go. I do believe.
Right. Well, I think annatto is another fermented food that's high in K2, but I actually prefer to recommend that people try to get these vitamins from having proper nutrition. And so if you take a lot of supplemental vitamin D, for example, it can actually have a negative feedback inhibition on your body's ability not only to synthesize its own vitamin D, but also to make other hormones in the vitamin D pathway, which might include some things like your sex hormones. So what I generally recommend is that people get more cholesterol in their diet, get off cholesterol lowering medications, and that because your body makes vitamin D from cholesterol. And then you need to get some exposure in the sun. And even I find in northern climates, this can still be achieved for the most part. Maybe during the coldest, darkest winter month, you might find that taking some supplemental vitamin D is okay. But definitely as you get more outside, I think it's far better to allow your body to kind of do its own thing. However, of course, if you're in a situation where you don't have access to these things, and it seems like with regulations that sometimes it is quite difficult. And I mean, I am surprised all the time that a woman from Canada who wanted to use some bentonite clay that I talked about on a show, that she went to the local health food store and they told her it's illegal to take bentonite clay internally in Canada.
Wow, that's astonishing.
And yeah, it was just shocking. So she was at a loss. And of course, you always make your own decision and you don't need to tell people around you what you're doing. I believe you have a right to make decisions about your own body. But so these are the kind of things that have resulted in these deficiencies.
Yes. Yeah, it's a tragedy that all these natural remedies are taken away from us. It's pushed into the corner of illegality, and that's just a very bad thing that happens these days.
Absolutely. So let me get back to the breathing issue because I do a lot of kind of breath work related to meditation and trying to help people with anxiety. And I always recommend nasal breathing because there are several mechanisms with nasal breathing that are actually much better than breathing through your mouth. So I want to mention these. So the first is that your nasal passage actually humidifies the air that you breathe in, which is nicer to the lungs. The second thing it does is that all of the little hairs inside your nose, and then there are these like waves in the bone called turbinates,
Yes.
and they provide a lot of surface area for the air to push against the little hairs and cilia coming off your mucous membranes, and that filters particles and toxins out of the air so that they don't reach your lung, and that's what comes out when your nose drips. And it might go back down the back of your throat, but that's your body's way of keeping those things out. And then the third thing it does is it actually warms the air. So it's less of a shock to your lungs, and it can exchange oxygen more readily. And then one other thing that I only learned about recently, and this is quite fascinating, that there is nitric oxide that is mixed into the air you breathe in your nasal passages. And what that does is it's a vasodilator. So it makes the capillaries in your lungs open up, and that allows for better gas exchange. So more O2, CO2 exchange. So it really improves your breathing. Yes. And so this is a really, really important thing, Dirk. What are the consequences of mouth breathing and of this kind of an issue with jaw underdevelopment?
Well, what you mentioned is everything that I know about it too. So if you, like the nitrous oxide, it somehow supports the uptake of oxygen. So actually you don't need that much oxygen if you breathe through your nose as if you breathe through your mouth. But see, dental issues also come from mouth breathing and snoring, for example. Yeah, there's a big problem with snoring. Snoring has to be taken very seriously. It's not just like a funny thing and it annoys your partner when you do that, but it actually, you are oxygen deprived if you snore, and it happens mostly because of mouth breathing. So what happens is, like, we see the thinking in dentistry also regarding grinding your teeth and wearing them down has changed a little bit, because what happens in the night, if you snore, you're oxygen deprived, and you try to compensate, and what you do is you push your teeth forward and you start to grind to open up the airways again. And it's a kind of emergency mechanism, because you are actually oxygen deprived when you snore. And sleep apnea is even a worse form of that. Wow. So those are the consequences if you do mouth breathing, because your nasal passages are closed off. And that all starts with the nutrition and not forming the facial structures and the bones correctly during your growing phase. So everything is diminished, everything is smaller, you can't breathe through your nose properly, you compensate by breathing through your mouth, you don't get enough oxygen, you don't sleep well at night, you don't fall into deep phases of sleep anymore. Somehow your whole body and your brain doesn't recover properly from the stress during the day. And so it has tremendous consequences for your overall health.
Wow. So, I have to say, during that whole time you were talking, I was making sure to not breathe through my mouth.
Yes.
But what you said about sleep apnea, that is something that has all sorts of really bad outcomes. I mean, it's definitely associated with depression, but also with cardiovascular disease and shorter lifespans. And I think also that chronic lung disease may be associated with this problem to some degree as well. Yes. So this is a serious health problem. Certainly for children, we can give them the proper nutrition so that they can have proper growth that we talked about. But what if you're already an adult and you're kind of facing this issue? What are the kind of things that you recommend?
Well, some people say you should somehow cover your mouth. So you should tape your mouth so that you are forced to breathe through your nose. I tried that myself because my facial structures are also not quite developed properly. I also have the problem with my sinuses. All of my life, I had kind of sinus problems. Somehow you can try to train yourself to breathe through your nose by taping your mouth at nighttime. This sounds awful, and somehow my first reaction was, you might not be able to breathe anymore, but you will wake up probably. I don't like that. I personally, But what I do is there are these little tapes that you can put over your nose. For some people it works. It works for me quite well.
Oh, right. The breathe right nasal strips.
Exactly. They work for me, believe it or not. So because now I'm very much aware that I shouldn't breathe through my mouth. Unfortunately, what happens for me is in the middle of the night, my nose gets quite stuffy, and then I'm waking up with breathing through my mouth. And these days I'm panicking about that. So I put these things on, and it works quite well for me. I don't know if it works for everyone, but that's another tip. So mouth taping and these little strips that you put over your nose, they might work because they open up the passages. Because in many cases, the problem with the nose is that you have a deviated septum in your nose, and that blocks off one. For me, that's the case. So this side is much more blocked than the other side.
Wow.
With those tapes, it opens it up a little bit, and it works quite well for me.
Well, we have to know those nasal strips work because you see them on professional football players. Exactly. And such, right? But I think you bring up a good point here because I had the opposite experience. I tried the nasal strips first, and I felt like they were pulling my skin off. They were uncomfortable. And then I tried the mouth tape, and I actually really like that. And so I still use it most days. But after about 6 months, I noticed that if I was without it, I was just naturally breathing through my nose much more just from doing this practice, even during the waking hours. Yes. And one other thing that was very surprising, because I always have like nasal congestion issues, especially at nighttime for some reason. Probably the dry air, because I live in a cold climate and the heat really dries things out. So sometimes it would be hard to breathe through my nose right when I went into bed. And so I'd be like trying to blow my nose and clear it. But I noticed that if I just put the tape on, even if my nose is stuffed, after a couple of minutes, it opens up. It's like magical. It's like the body somehow knows that now you have to breathe through the nose. So it has to, constrict those blood vessels and get the swelling back and clear whatever's in there so you could breathe clearly. And it's really been an excellent experience. I've repeated that with myself several times and just been amazed at how well it works for me. Yeah. But I certainly understand, having the tape on your mouth and sometimes it falls off and it's a strange feeling. It's not for everyone. So I think you people have to, sort of experiment with this and see what works for you. But certainly while you're awake, you can definitely practice nose breathing. And so I'll tell you what the posture that I was taught that seems to work. And you tell me if you have any advice. So what I suggest you do is that you just close your lips and put your tongue on the roof of your mouth inside your top teeth. Mm-hmm. And that motion helps actually open up the nasal passage a little bit. And try breathing through your nose just like that. So is that a reasonable technique, Dirk?
Well, I do believe so. I mean, I experiment myself with things. So if my nose is blocked in the middle of the night, I don't have the problems during the daytime. But as I mentioned, it somehow happens during the night. I actually, you're probably familiar with the Buteyko technique.
No. Please tell me about it.
Well, look, I have to really think deeply because I have to grab my memory. I think it's if you stop breathing for a little while, somehow the oxygen in your blood gets diminished and the CO2 level raises, and that makes somehow the body gets into a reaction that the body somehow opens up the airways much better. So if you take a breath and you keep it in for as long as you can, that raises the CO2 level within your blood, and some sort of mechanism sets in that the nasal passages opens a bit, and that seems to work for me at times.
Interesting. So that would be
that's
uncomfortable.
Be way to go about it.
Well, I was going to say what that would do is that's what's called a respiratory acidosis.
Exactly.
Right, because you're holding on to that CO2, and in our blood, CO2 is actually what makes our blood acidic. It's in a reaction with water, and it forms carbonic acid. So I wonder if it has something to do that, but maybe we can find the link that explains a little bit more about that, and I'll put that in the show notes.
Yeah. Yes. Now, generally speaking, I think we have to take this very seriously, the snoring and the sleep apnea, because it has such bad consequences for your overall health. Now, there's a new field in dentistry which is called sleep dentistry. And if someone suffers from that and has to suffer the consequences of bad health because of that, I would highly recommend that they look up someone who specializes in sleep dentistry. What they probably will recommend is some nighttime sleep observation, what happens during the night while you're doing that. So it's quite a big procedure to go through, but they seem to be quite successful. And the measurements that they take then afterwards to help you with devices, it has to be individually designed. But because it's such a serious problem for many people, it has to be taken very seriously, the whole sleeping and sleep apnea and snoring thing. So there are some devices that you can use, but that's also not my field of expertise that I can go much into that.
Well, Dirk, thank you so much for going over that. I mean, I think that you covered some really important points here about how nutrition has led to a lot of our modern dental problems and how dental problems actually can cause general health problems. You know, I think it's really important for people to understand that our body is a whole system and all of the parts are related to each other, and you can't just choose one part in isolation. So when there's issues in your mouth, there are going to be issues in other parts of your body related to that, and you can't really separate those things. Yeah. So I know that our audience really wants to know more about amalgams and what kind of problems they could have. So let me just introduce a little bit about this topic, and then you can tell us a little bit about how you can deal with this. So most of you may know that these silver amalgams that many of us have been placed in our mouth as fillings for dental cavities contain mercury, and that this mercury is one of the most probably the most toxic metals to our body, aside from maybe some radioactive compounds. And mercury principally is toxic to the nervous system, but it is toxic to other areas of our body as well. And back in the 1800s, a lot of doctors in our country actually prescribed mercurial drugs, and they would actually give these drugs until the person developed mouth sores to know that that was an adequate dose. But it seems so strange that you know that it's poison and it's making the person sick, yet somehow it's meant to heal them. And, so they continue to use mercury in a lot of medical products. Sometimes it's used as a preservative, like thimerosal, that used to be added to a lot of vaccines and is still in a couple. Mercury maybe was used as an antiseptic, like when I was a kid, people put mercurochrome on cuts, a mercury-containing compound, not realizing how dangerous it was. So I think most people would probably have some type of neurologic illness, and this could be quite variable depending on how much mercury gets into their central nervous system. But a lot of diseases like diseases of the cranial nerves, diseases like Parkinson's, even dementia, other neurodegenerative diseases could possibly be related to this. They maybe have other causes as well, but this mercury could be a big issue. So are those the kind of people that get referred to you?
Yes. See, I'm in the position here that I work closely with health professionals that send me patients who are where they have mercury fillings, and the health professionals tested them with all sorts of means and came to the conclusions that those patients would benefit greatly if the mercury fillings get removed. And we do that in a particular way. There's a protocol which is called Safe Amalgam Removal Protocol. And I've got actually a little video of half a minute that I can show you how we do that in our clinic. But
Yeah, I'd
maybe,
love to, but Dirk, let me just ask you, like, what are the risks of doing this? Because since mercury is such a dangerous compound, and by the way, it even in tiny amounts, right? It can be quite toxic. So what are the risks of this, and how do you deal with that?
well, see, normally conventional dentistry doesn't really take those risks into account. So they just go in there with the drill and drill it out like a normal hole in the tooth or an old filling. The problem with mercury fillings, with the amalgam fillings, is as soon as you put the burr to it, you create some sort of heat, and the mercury or big parts of the mercury within the filling gets released as mercury vapor. And the problem with that is because it's also close to the breathing process, the vapor gets sucked in, so you breathe it in, and the moment you breathe it in and it gets into your lungs, they estimate that about 80% of the vapor gets immediately resorbed by the lungs and distributed in the blood system. And then it goes anywhere in the body. So it settles wherever it settles, in the brain or in other tissues. And there it just causes havoc. So what you need to take care of if you remove the mercury is that you protect the patient and the staff and yourself from this mercury vapor that develops when you drill out the filling. So there are particular things that you can do. You can put a rubber dam over a tooth. A rubber dam is this rubbery thing that separates the tooth from the rest of the mouth, so that any vapor, and you have to use latex-free material for that, that the vapor doesn't get under the rubber dam and gets somehow resorbed by the body. And you have to use particular burrs for that don't generate so much heat, and a particular handpiece that is not a high speed, not a turbine, with that creates the heat.
So it sounds like you're doing two approaches there. One is you're creating like a protective physical barrier between any of the healthy tissue and just the tooth with the amalgam filling, right?
Yes.
And then the other issue is you're trying to minimize the amount of vapor that you create by using special instruments that operate at low speeds and low temperatures.
Exactly. And then you need filter systems within your dental unit that catches the sludge, the amalgam sludge, to protect the environment. So we've got really fancy things these days that can do that, while in the past, and maybe many dentists are still working with that. So the mercury or the old filling that presents then as a sludge just goes into the waterways, which is an absolute disaster. So you need to catch that. It needs to be collected by some environmental collection service that deal with
Mm-hmm.
the remaining amalgam. But also you need some high volume suction in it. So that's, when you go to the dentist and he sucks away the saliva
Yes,
and
yes.
fluid. So that needs to be high volume. So whatever is generated as a vapor gets immediately sucked away and gets somehow out of the surgery, so that the
Wow.
surgery itself is not contaminated, and you yourself and the patients are exposed to this sort of vapor all the time. Our surgery was designed that way to facilitate that, so that the suction unit itself is not within the surgeries generating all this vapor, so that it's just in the surgery and you breathe it in just in lower doses. And the other thing is we also have a special machine. It's a mercury filter system. You can see that in a minute in the picture, which is it's a bit like a very strong vacuum cleaner with mercury filters in it. So we have the high volume suction and an extra device that sits over the head of the patient, and that sucks away any mercury vapor that might come out of the mouth. So that's taken care of as well. We, the staff, my assistant and myself, we wear actually gas masks to protect ourselves.
Wow.
Yeah.
So it sounds like you've gone to some really extensive precautions. So, and you have a video showing this procedure, right?
Yes. Let me try to show you. It's just a half a minute long. So, am I sharing now, Andy?
Yes, yes, I can see the video.
Okay, so this is the special machine we call it the Snuffleupagus because it's a very strong machine. Within the box down there, there are mercury filters, and we just put it over the head of the patient. It's quite noisy, so I took down the volume. And here you see the patient with rubber dam. So that's a latex-free material. And now I show you somehow, this is the special handpiece. It's not a turbine and a special burr. And this is the tooth. You can just see the amalgam filling, and there's a rubber dam. And this is the mask. It's an oxygen mask with positive air pressure. That's important too, so that the patient doesn't breathe in what's coming out of the mouth. So
right.
Yeah. So and there you go. So that's the.
So you're irrigating it with water there to keep the drill cool.
Exactly, and the filling itself.
And what about after the pieces come out? What do you do to the tooth after the amalgam is out?
Well, the patient before we start. So let me just check one thing. Am I still sharing?
No, you're back.
Okay, good. Well, the patient actually has to rinse before we start with a charcoal liquid. So because the charcoal somehow is supposed to bind the mercury within the mouth, and after the procedure, he has to rinse again with the charcoal fluid, so that maybe any particles or whatever is lodged within the skin of the mouth somehow gets bound and spit out. So,
right, that sounds like a good procedure. And I've definitely recommended charcoal, and there's other things like bentonite clay and zeolite that also have been shown to be very potent at absorbing heavy metals. And what about putting another filling back in the tooth?
Well, it depends on the size of the cavity, what's left of the tooth. So if you have a medium-sized cavity, you can use materials like composite, and there are nice composites on the market these days which are BPA-free. Most of them still contain BPA, but there are a few composites that are BPA-free. Although this is not the biggest concern that they contain BPA, because still we have to use bonding materials, and we can't get away from BPA containing bonding materials. So a small cavity can be filled with a composite. If it gets bigger, you will need a crown, and there are also fantastic biocompatible materials out there like zirconia, which are very strong these days. You can use those. But as I said, small, medium can be changed with composite. If it gets bigger, you need a crown to stabilize the tooth. So crown, many people still don't know what a crown is. A crown somehow stabilizes the tooth, because the crown, if you imagine this is the tooth, this is the crown, it sits over the tooth and holds it all together. So if you have a big cavity and there's not much structure left of your tooth, you need something that holds it much better together than just filling alone.
Fantastic. And I want to, just tell the people out there that when Dirk does this procedure, he has people referred to him that have some serious health problems, and most likely they've tried some other different approaches before going this route, because there is some risk. And while it looks like your operation is really top notch, there may be some dentists out there who may be doing this without the proper equipment or training. So I would encourage everyone to really do some careful research before thinking about going through with this type of a procedure. And also it is, I think, quite an investment in terms of that it will cost some serious money, and will probably not be covered by any insurance. And then the last thing I'll say about this is that not everyone has a benefit after going through this procedure. So you have to sort of really think carefully if this is right for you. But certainly if you have serious problems, and if you tried the appropriate ways to manage it that are more conservative and have had no results, this could be a definitive treatment for you.
Yes, that's true. But again, what you mentioned already, it's not for everyone. Not everyone will benefit from it. And if people are seriously ill with neurological problems or chronic fatigue, They have a lot of hope when we do these sorts of procedures, but it does not work for everyone. That's the risk. So people just have to take this into account. And as you mentioned yourself, there are tremendous costs involved. Dentistry is very expensive, and to do. And I also would like to mention that I think it's a good idea generally to do that. I did that. See, when I grew up myself in Germany all those years ago, I had lots of amalgam fillings myself because that was the best way to, or supposedly the best way to deal with it. And
Right.
I got them removed in my 20s without any precautions. I don't know if I had any ill effects from that. I feel quite good still these years, but that was just the way it was done. The thing is with amalgam, it also, as a filling material, it has quite some bad properties to it because just shying away from looking at only the mercury aspect and the toxic effects of that within the tooth, many people have the experience, and I do believe many people who watch this video had a tooth crack because of an amalgam filling. The amalgam does not bond to the tooth, and therefore it weakens the remaining tooth structure. And because amalgam also oxidizes over the years, it changes in volume, it actually expands. And if it sits within the tooth, then it can bust the tooth open and teeth can crack.
Wow.
And if you have a cracked tooth and the crack appears in the wrong place in the tooth, it can actually split the tooth in half and you lose the tooth. And many teeth are lost because of old amalgam fillings. That's a very
Wow.
thing.
If that happens, is there a risk of mercury contamination from the amalgam?
Well, there's generally a risk of that because of the mercury vapor might disappear through the porous tooth structure, the dentinal fluids, which leads into the center of the tooth, and there's the blood supply. I don't believe that a cracked tooth causes an increased mercury exposure to the patient.
Oh, that's good to know.
But it's just that the crack it can be quite devastating because there are people with small fillings and suddenly the tooth cracks and the tooth is lost in many cases.
Right, yeah.
Because of amalgam. The modern material, they bond to the tooth and they hold it much better together.
Well, that's really good to know. So, Dirk, it looks like we've taken up all of our time here. So this has been a really, really interesting and informative discussion. I mean, I can't tell you how many things I learned today. So I want to thank you for taking the time to talk with me about this. And of course, we had a few topics that we didn't get to, so perhaps we'll have to do a part 2.
Yes, I would be happy. And thank you for inviting me, Andy. That's great.
Oh, it's my pleasure, Dirk. So why don't you take an opportunity to tell the listeners out there how they can contact you and learn further about these issues?
Yeah, well, I'm actually in the position that I'm establishing a new sort of business for myself. I'm not doing clinical dentistry anymore. I'm shying away from that now because actually my plan was to go and have a sabbatical year at the moment and to travel through the US. That was our goal, but because of the corona thing happening right now, we are in lockdown here in Tasmania and we can't go anywhere. But at the same time, I'm establishing a business right now, which is more an online dental consulting business. And this might be helpful for people who feel like they need a second opinion on their dental issues, because it's often the case that people go to the dentist and they get presented with all this information. They get presented with some sort of treatment plan. They are overwhelmed. Often they are sometimes intimidated by the whole atmosphere in the dental office and the dentist, and they are in a very vulnerable situation, opening their mouth and things are done to them. And often they feel like, hang on a second, I get presented with this treatment plan. I feel a little bit railroaded. Suddenly I have to spend on big procedures and it goes into the $10,000, $20,000, $30,000 implants.
Absolutely. So you're saying that you could actually review their file and talk to them and let them know if they really need all that kind of work, or what would really help them meet their goals in terms of improving their oral health?
Exactly. So it is a simple way of contacting me. All I basically need is some X-rays. So because X-rays, they contain so much information that I can base some sort of consulting service based on that. And maybe people can take some selfies of their teeth. They don't have to be of any perfect quality, but they are helping a lot too, so that I can see what sort of filling is there and a description of their problem. And then if I have this information, and X-rays can actually easily be requested by the dentist. It's just a simple form. You request your dental records, and dentists, they need to email that back to you. That's just the case. I can give information there. So if that is something that people are considering, some people just want to speak to some expert that is unbiased, that doesn't have any interest in providing any services, doesn't earn from that. So I can claim that I'm 100% unbiased because I don't earn from what I actually recommend. And some people just want to have some feedback and think of, talk about some other alternatives that might be available to them. And they are shying away to discuss that with their dentist because they don't want to atmosphere. So this is where I can help.
Well, it sounds like a really excellent service. And, there is a conflict of interest for a lot of us practicing medicine, because we earn more money as we recommend more procedures. And that's not necessarily in the person's best interest. So it sounds like you can help reduce anxiety about dental work. You can help reduce the agony and pain and discomfort of going through unnecessary dental procedures. And you can help people save money by not paying for unnecessary procedures. So, Dirk, do you have contact information where people can reach you and find out more?
Yeah, well, look, as I said, now I'm sitting at home. I'm working intensely on this because I can't go anywhere these days. And people can contact me. So my website will be, I don't know if you can see that. So this is my website. It's called drdirk.com. And I will be launching that probably in the next couple of weeks. So it's April 2020. But at the moment, if people want to get in contact with me, they can just write to this email address. It's called drdirk@dentaldecoded.com. So,
well, that's perfect, Dirk. And I will put those links in the show notes as well. So once again, thank you so much for joining me and giving all this valuable information today.
Okay. Thank you, Andy, for giving me the opportunity. And I'm more than happy to come back, and we can talk about other things like root canals and stuff like that.
That would be great. So let me remind everyone, if you like this video, please click the like button below, and don't forget to subscribe to my channel, Medicamentum Authentica, and I'll be seeing you again soon. Thanks.